The orbit. The orbit are two quadrilateral pyramidal cavities situated on the facial part of the skull between the facial bones and cranial bones. It formed by 7 bones, such as orbital part of ethmoidal bone, lacrimal bone, orbital part of maxilla, zygomatic bone, and greater wing of the sphenoidal bone. Also, to this part belongs the orbital process of palatine bone. All the 7 bones form the 4 walls of the orbit. The inferior wall, or floor of the orbit, parius inferior, formed by orbital surface of maxilla and orbital surface of zygomatic bone. Also, to this part belongs the orbital process of palatine bone, the medial wall or inner wall of the orbit, formed by the orbital surface of ethmoidal labyrinth, ethmoidal bone, and orbital surface of lacrimal wall, also known as facies lateralis or lacrimalis. Next surface of the orbit, it is roof, which formed by the orbital surface of orbital frontal bone, parius orbitalis, facies orbitalis or frontalis, small portion of greater wing of sphenoidal bone. Lateral wall of the orbit formed by orbital surface of greater wing of sphenoidal bone and orbital surface of zygomatic bone, facies orbitalis or zygomatici. The communication of the orbital cavity or orbit or eye socket provided by several fissures, openings and canals. For example, on the apex of the orbit located behind, you can find the 2 canals such as canalis opticus and superior orbital fissure. Both of them leads to the medial cranial fossa. Means orbit communicate with medial cranial fossa through optic canal and superior orbital fissure. Next communication located on the gap on the floor of the orbit is inferior orbital fissure, which communicate this fossa, this socket, with infratemporal fossa and pterygopalatine fossa, means inferior orbital fissure. Fissura orbitalis inferior communicate orbit with 2 infratemporal fossa and pterygopalatine fossa. Next communication of the orbit is the orbit with canine fossa through the infraorbital foramen. There is infraorbital foramen which communicate orbit with canine fossa. On the lateral wall, 2 openings which communicate orbit with the lateral face through the zygomatic foramen, such as foramina zygomatica orbitalis through the foramina zygomatica facialis. On the medial wall, the canal which provide communication to the nasal cavity. It is nasolacrimal canal, which communicate nasal cavity with eye socket. Also on the medial wall of the orbit you can find the small foramens, which calls anterior and posterior ethmoidal foraminas, which communicate nasal cavity and anterior cranial fossa. In the topic of the content of orbit, we can name only eye organ. Nasal cavity. The nasal cavity, cavitas nasi or cavitas nasi ossea, is large irregular period structure or irregular cavity which situated on either sides on the midline of the face, extending from the base of skull to the floor of the mouth. These 2 cavities, separated by nasal septum, has 2 apertures, anterior or external, which calls nares, and posterior, which calls also posterior nares, anterior and posterior nares. Posterior calls choanas, choana. Anterior calls apertura piriformis. Yes, there is apertura piriformis. And on the posterior side, you can see this purple. It is choanas, 2 choanas, separated by the nasal septum. Bones which form the nasal cavity: maxilla, nasal bone, inferior nasal concha, ethmoidal bone, vomer, sphenoidal bone, and palatine bone. Sphenoidal, palatine bone, frontal bone, and lacrimal bone. There is sagittal section of the skull and better view for the nasal cavity. Here you can see the different bones of the nasal cavity. Again, I will label it again: the maxilla, the ethmoidal bone, the vomer, the inferior nasal concha, sphenoidal bone, frontal bone, palatine bone, nasal bone, and lacrimal bone. Walls of the nasal cavity. Nasal cavity has a roof, floor, an inner and an outer wall. Upper wall or roof of the nasal cavity, formed by ethmoidal bone, frontal bone, extend from the cribriform plate of ethmoid bone, a front of the body of sphenoidal bone, and small portion of the nasal bones form the roof of the nasal cavity. Middle wall or inner wall of the nasal cavity formed by lateral surface of the perpendicular plate of the ethmoidal bone, anterior surface of the body of sphenoidal bone and rostrum, vomer, also nasal surface of horizontal plate and nasal surfaces of the maxilla. The second name of the middle wall of the nasal cavity, the nasal septum, which formed by the perpendicular plate of the ethmoidal bone, the rostrum and sphenoidal concha of sphenoidal bone, the nasal crest of palatine bone and nasal crest of maxilla, also by the vomer, and the nasal spine of frontal bone. The lateral wall of the nasal cavity. First of all, it is nasal surface of maxilla, it is lacrimal bone, medial surface of inferior nasal concha, nasal surface of perpendicular plate of the palatine bone. And next wall is inferior wall, which formed by the bones which form also the hard palate. It is horizontal plate of the palatine bone and palatine process of the maxilla. Communication of the nasal cavity. Before this start, describe the communication of the nasal cavity, should be mentioned about the nasal meatuses. The nasal meatus is the passage which formed by the structural bony part of the nasal cavity which form air passage or turbinalias to warm direct the air or olfactory particles to the specific region of the nasal cavity, such as paranasal sinuses, to warm up to moisture and direct it to the nasopharynx. The nasal cavity has 5 nasal meatuses. First of all, the nasal meatus, which formed by inferior nasal concha, and maxillae, which call it inferior nasal meatus. Second, medial nasal meatus, which formed by the medial nasal concha, which is part of the ethmoidal bone. Also, there is superior nasal meatus. Why again? Superior, middle, and inferior nasal meatuses, and air pass through each of all of them. Next one, it is common nasal meatus between the nasal septum and conchas, which formed by nasal septum from the midline and surfaces of ethmoidal and inferior nasal concha. And last one, nasopharyngeal meatus, 5 nasal meatus. There is coronal section of the skull through the nasal cavity, and you can see the most of the nasal meatuses in cross section with their communication. First of all, meatuses communicate with these paranasal sinuses. Means on this review, we will see only communication the paranasal sinuses with nasal cavity. First of all, inferior nasal meatus not communicate with either, but it has communication with the orbit. The orbit communicate with inferior nasal meatus through the nasolacrimal canal. Middle nasal meatus communicate with maxillary sinus and with the frontal sinus. Middle nasal meatus communicate with maxillary sinus and frontal sinus. Also, partially communicate with the anterior and medial cellulus of the ethmoidal bone. And superior nasal sinus communicate with sphenoidal sinus. There you can see the opening of it. Also, ethmoidal cellulus. Review of the communication of the nasal cavity. The inferior nasal meatus communicate with the orbit through the inferior nasal meatus. Communication between with the hard palate and oral cavity through the incisive foramen incisivum, which form the canal as you saw it on the palatine process of maxilla. Next communication is medial nasal meatus with maxillary sinus, frontal sinus, superior nasal meatus with sphenoidal sinus and posterior celluloesophagemoidal bone. Also, do not forget the pterygopalatine fossa and communication the pterygopalatine fossa with nasal cavity through sphenopalatine fissure. Also with external skull or with environment through the foramen piriformis and with the nasopharynx through the coans. Also is communication of the roof of the nasal cavity with the anterior cranial fossa. And last structure of this topic is the hard palate, which formed by the horizontal process formed by the palatine process of the maxilla, horizontal process of the palatine bone, fused together by the medial suture and transverse suture. Medial suture call it medial and transverse call it same, transverse palatine suture. Communication of the hard palate is first canalis incisivus with nasal cavity with common nasal meatus and palatine greater, palatine lesser foramens communicated with pterygopalatine fossa.